We're going to look at some special tests for the shoulder. The first series of special tests will look at stability, so general stability, anterior and posterior stability of the shoulder. The first test will be the apprehension test. This test is performed with the patient supine, and what the examiner will do is position the shoulder in 90 degrees of abduction, start in neutral rotation, and then place their hand under the posterior aspect of the glenohumeral joint. And then the test is performed as the examiner externally rotates the shoulder and then puts an anterior force on the glenohumeral joint, so trying to dislocate or stretch the anterior structures of the anterior capsule of the shoulder of the glenohumeral joint. Negative test or normal response would be that the patient is stable, they have a solid end feel, there's no signs of apprehension. A positive finding would be the patient is apprehensive, they react, they stop, they ask you to stop the test, they get nervous, they say don't do that, or they pull away as you do the exam. And what this test does is it stretches the anterior structures, especially the capsule of the shoulder, and causes the disintegrity of the anterior structures of the shoulder. One of the tests that can follow this is called the relocation test. And it's the same position, 90 degrees of abduction, start in neutral rotation. And then what the examiner does is they put their hand over the anterior glenohumeral joint and push down posteriorly. And what they're doing is they're acting as a stabilizer. So they're tightening up that anterior capsule. And then the examiner will externally rotate. And a normal response would be stable or no signs of apprehension. A positive finding would be if they had a positive apprehension, and then now what would happen is they would not be apprehensive. So you kind of stabilize their shoulder. That would be a positive relocation test. So you're stabilizing the shoulder with your force. The last is looking at posterior glenohumeral instability. This would be the posterior apprehension test. Again, the patient is supine. And now what we do is we position the arm in 90 degrees of flexion. And you can bend the elbow to 90 degrees. And then what the examiner does is they put a posterior force. All right, so I'm putting an axial force posteriorly down on the shoulder. And then I'm going to horizontally adduct and internally rotate. And again, what this does is if there's no structural stability of the posterior capsule, the patient will become apprehensive. They may stop you. They may ask you to stop, or they may pull away as you're doing that test. That would be a positive response. A normal response would be no reaction or stability of the posterior joint with that test.